Dear friends and colleagues and attendees, although social media and online information has gained popularity in the last decade, the pandemic has added a lot to the importance. However, there are good things going around as well as bad. So, a new issue raised social media monitoring. In other words, the act of monitoring social media for information relevant to your business. Almost every business has a social media page, either on LinkedIn, Facebook, Instagram, or Twitter. Therefore, social media marketing is considered already a part of the marketing strategy. Knowing what your customer is talking about and where the conversation is taking place give you consumer insights. It will aid you in products or future development and crisis management if the conversation is about the good work your business has been done. But if it is a complaint, then it will be best for you to address it before it becomes wildfire. As you know, the consumers of IPA are pediatricians, child health workers, families, and children. We have to know what is going on there, what are their concerns, priorities, needs, thoughts, and know social media is the best to collect data. So I believe we have to monitor social media. Once we start collecting this valuable data, we can use it to look for trends and insights. Social media monitoring is the process of using a tool or software to monitor what is being said online. We have to decide which tool is best for our social area. So the choice depends on our needs. Tools may be different when in terms of interface, usability, or features. Price, of course, is another important factor. We should consider of it as well. Then comes the appropriate keyword selection, which should be based on wise and simple features. I believe social media monitoring will increase the impact of IPA on children. And in this meeting, we are going to discuss the opportunity and to learn about social media. Thank you very much. Before I leave the stage, I am going to leave the stage to Professor Shalat for moderating this meeting. Professor Shalat is Professor of Communication and Digital Platform and Strategies of MIC at Ahmedabad. She has taught and worked as media consultant and researchers in India, Thailand, and USA. She has PhD communication degree from University of Wisconsin, United States. Her publications include books, journal papers, and book chapters. She got many awards and fellowships, include Soviet Land Nehru Award, Shastri Indo-Canadian Faculty Research Award, and Salzburg Seminar Fellowship as well. She is also the editor of Journal of Creative Communication. She has led several capacity building programs for non-profits, various state governments, corporate sectors, and international organizations in communication and information management She is an active member of the leadership for vaccine confidence. The stage is for you, Professor. On and good luck.
Thank you very much, Professor Enver, for introduction. And before I go ahead and welcome Dr. John to give his opening remarks, I would like to share some instructions with you and also some interesting information about an online course. So, Amrita, can we go on to the instructions, please? So, three important instructions for everyone. Please turn off your video when you are not speaking. And also it's good to keep yourself muted so that there are no background sounds. Please rename yourself the same way that you have registered. And if you have any problem, any technical issues about how to rename yourself or any other problem, please privately message Amrita at Child Health Foundation and she will help you with that. So this will really help us give you the certificate and mark the attendance. And when, after Professor Yadav's talk, when we go to the question and answer session, please raise your hand and we will give you speaking rights. You can also put your question in the chat. So either way, it is fine. So next slide, please. Yeah, so I'll just walk you through the agenda for today. Soon after I finish sharing the information about the course, I'm going to invite Dr. John for his opening remarks. And then we'll straight away go to the session by Professor Anubhuti Yadav on how to monitor conversations on social media, which will be followed by question and answers. So I hope you have lots of questions. And then Professor Pullingan will give his closing remarks. So that is the agenda for today. Amrita, can we go to the next one? Yeah. So before we proceed to the talk today, I want to share information about a very interesting and relevant online course that IPA is offering. This course, spread over 7 modules, is available in 7 languages. So English, Spanish, Russian, French, Portugal, and Arabic. So you can take it in a language that you like. And it is also a course which will take like 10 to 12 hours, which you can also do in multiple sittings. So it's very conveniently designed. And it's a very useful course, I would say, for frontline health workers, policy makers, doctors, media persons, anyone who is actually interested and involved in building vaccine confidence. So, and additionally, it's a free course and Amrita will share the link on the chat for you to register. I would also very quickly draw your attention to 2 important platforms. And if you enroll for the course, you will be invited to join these platforms. So IPA has recently launched a web-based platform, which is the Global Leadership Forum. And it really brings, experts and peers in the field of immunization and vaccine confidence on the same platform so that they can deliberate and gain from each other's experience. You can share your thoughts, discuss ideas, and also very important goal of this platform is that we all need to come together to stop the spread of misinformation. So we hope that you will be joining this platform too. Amrita, next please. And then the National Leadership Forum also has a platform for vaccine confidence. This is also a web-based platform. You can share and exchange knowledge and information, success stories, even challenges. There are tools for vaccine misinformation, surveillance, and response. And very important part of this platform would be we will all be sharing the good practices that we have experienced and other people can learn from our experiences. So please remember that there are all these resources for you to join up to this workshop. We also have IPA YouTube channel. The link is right here. And Amrita will also again post the link for you in the chat so you can save it. And we hope that with all these resources, IPA and Child Health Foundation both have several social media platforms on Twitter, Facebook, they have their websites, YouTube channel. So please, we just hope that, you know, we will use all these platforms to collectively come together. So I think please have a glance at the instructions once again, and then we proceed with today's program. Thank you, Amrita. So now I would like to invite Professor Jacob John for his opening remarks. And sir, it's a privilege for me to introduce you. Dr. John is a leading expert in child health and virology, known in India and internationally. He is an emeritus teaching faculty of Christian Medical College, Vellore. He has served the Child Health Foundation as its chairman from its inception. So he has a big role to play, you know, in all of us coming together. He had served as president of Indian Academy of Pediatrics and as president of Indian Association of Medical Microbiology. Dr. John is a former director of ICMR Center of Advanced Research in Virology and National HIV/AIDS Reference Centers, both in Christian Medical College, Vellore. Dr. John's academic interests span infectious diseases in general and viral infections. After retirement, he has remained very active. He has continued to be a freelance scientist, in which capacity he had solved the mystery diseases in 3 places: Saharan, Uttar Pradesh, Muzaffarpur, Bihar, and Malkapuri, Odisha. Dr. John has published over 500 scientific papers on a variety of infectious diseases and also on vaccinology. So, sir, I welcome you and request you to give your opening remarks, please.
Thank you very much. Am I audible?
Yes.
I do not want to break the trend of thought of the workshop, so I shall be very brief. And my main function is to tell everybody what Child Health Foundation is and to welcome all of you to this very, very important and timely workshop. Child Health Foundation is a very tiny organization in a huge country, India. But you know, even an ant can bite the elephant and make the elephant irritated or run away. So Child Health Foundation, being small, has flexibility to do things that larger organizations like Indian Academy of Pediatrics, its own bureaucracy, procedures, whereas we are just a few individuals. Naveen Tucker's brainchild, I've been chairing it. We are a trust, and we set our own agenda. From the very beginning, our agenda was promoting childhood immunization and creating a defense force of pediatricians against anti-vaccine sentiments and attitudes, vaccine hesitancy, etc. Instead of addressing vaccine hesitancy and anti-vaccine sentiments directly, what we have done is to create network of pediatricians well trained, both in the government system and in the private sector, and educate them fully about vaccinology, what vaccines do, how it works, the safety issues, the efficacy issues, how to evaluate a vaccine, and above all, how to counter any negative messaging that comes to you, either at the level of parents or at the level of media. So during the last several years, we have conducted major international training workshops and smaller workshops in various Indian states. And we have created a national leadership forum consisting not only of pediatricians, but media people, lawyers, public figures, so that we have a wider thinking group who can address issues about vaccinations or any vaccine hesitancy or that kind of negative attitudes in society. Right now, in the middle of the COVID pandemic, immunization is a very, very important subject under scrutiny by all kinds of media. And it is now that the National Leadership Forum has to rise to the occasion and address these issues. And most of it, much of it, is in the social media. So this workshop is so timely and so well focused to address the real issues of today, of the, if you want to call it, infodemic, an outbreak epidemic of information, in which good information and bad information are presented side by side, and the public is confused as to which is right, which is wrong. How do they assess misinformation, disinformation from true information? So this is the background of Child Health Foundation. So it's my pleasure to welcome the IPA President, Executive Director, and Dr. Professor Shelat into our family, Child Health Foundation. Welcome everyone. Have a very nice workshop. Thank you very much. Back to you, Manisha.
Am I audible now?
Yeah. Yes, ma'am.
Yeah, thank you, Dr. John. I think you set the perfect context for Professor Yadav's talk on how to monitor conversations on social media. So I would like to now invite and welcome Professor Anubhuti Yadav from the Indian Institute of Mass Communication. And before she delivers her talk, I would like to give a brief introduction. So let me tell you that we could not have found a better person to deliver a talk on this topic. Professor Yadav is a leading personality in the field of new media, and she is the head of the Department of New Media and Post-Director of Advertising and Public Relations at IIFC. She is also holding the responsibility of the Dean of Welfare and is a member of Executive Council and Ethics. And I must tell you here that I have known Professor Yadav's work in this field for years as a leading researcher and practitioner. Professor Yadav is a Google certified fact checker and has conducted workshops on fact checking and verification for journalists as well as media educators and for various other audiences. And now today she will medical. She is a leading expert and an active promoter of media literacy, and that is actually where of us connected. She has undertaken various projects to promote media. He played a key role in the launch of National Repository of Open Educational Resources, the project she coordinated with the Ministry of Human Resources and Development. The project was mentioned in the highlights of achievement of the ministry in 2014. So, of course, there is a lot more that I can tell you about Professor Yadav, but I think I'll keep it brief today and would now like to invite Professor Yadav to deliver her talk. Welcome.
Okay, thank you so much, Professor Manisha. Thanks a lot. First of all, I would like to thank International Pediatric Association and Child Health Foundation to invite me here for this particular workshop. And of course, it was like very nice to listen to all the experts. For me, it's quite an unusual time. Usually we conduct our workshops, training programs in the morning, noon, but this is the first time I've been doing it, at 8 p.m. And at the same time, the audience is also like unusual for me. I mean, it's not very frequently we interact with, doctors or health experts and all, but, it's an opportunity for me to interact with all of you. And it was great listening to, all the experts here. So the brief which was given to me was to talk about social media and most importantly, social media monitoring. So I'll be talking about that. So I'll be actually taking you through my presentation. That's a 20 minutes presentation. And then, of course, I do have certain tools which I would like to share with all of you. These tools are, applicable for everyone, those who are in the field of media, but also those who are in the field of, health communication, whether they are doctors, frontline workers, everyone. Because nowadays, a lot is happening on social media. People are talking about, a lot on vaccine. In fact, like Professor Jacobs just mentioned about, vaccine hesitancy. He also mentioned about infodemic. WHO DG has said that, we are facing infodemic right now. So yes, the COVID-19 is very dangerous, but at the same time, the misinformation, disinformation around this disease is much more dangerous than that. And of course, while I was listening to the conversation which all the experts were having about the Delta variant, now we know that, parents are very anxious. The kids are the one, they are not vaccinated till now. So they're very anxious. So they might believe a lot of information which will come from social media. And it's the right time, very timely that, this particular workshop is being conducted. So just give me a while, I'll set up my presentation and then I'll take you through that. Okay, so is it visible, Amrita?
Yes, ma'am.
Okay, so this is what we are going to talk about. We'll talk about social media monitoring. How do we find all the information online that's relevant to us and our interest? So we all have different interests. We all have different requirements. I teach media students. My requirements could be, different. Many of you are in the field of, health. So your requirements could be different. But social media can play a very important role when it comes to collating data. There is a lot happening on social media. There is a lot of information there. Earlier, when we used to talk about research, we always used to talk about that. Let's go in the field and conduct the research. But now, the data is already available. It's just that the experts have to look at that data critically. They have to analyze it, and they have to come up with their findings. So what we are going to do in this 25 minutes, which I have, is one, what is social media monitoring? Then we'll talk about need for social media monitoring. Why do we require social media monitoring? Till now, we've been talking about social media as a platform wherein people can interact, they can engage with each other. But, this is something which is new, wherein, you're monitoring the content on social media. So what is the need for that? and especially in the context of those who are working in the health sector. And then, of course, we'll be talking about, certain tricks, certain tools for social media monitoring. There are tricks which I think each and every individual should know when they are searching content online. And then there are special, platforms which can be used for social media monitoring. So these are the three things which we are going to do in the 25 minutes which we have for this presentation. So when we talk about social media monitoring, this is also called social media listening. And it's all about finding, tracking online conversation. And these conversations are around keywords, phrases, events. Say, for example, when I'm saying keywords, phrases, events, it could be about, vaccines. It could be about, the different types of vaccines. It could be about, the effect of vaccines. It could be about, immunization programs in a one particular country. So it could be anything. And these conversations about your brand and business. So when I'm saying brand, I'm talking about, the different, experts in the field of health. They could be doctors, they could be hospitals. So, these conversations are about those brands and businesses, about your industry and about your competitors. And listening to conversations will help you find patterns and trends which you can use to your advantage. And this is what we have to do. We have seen that there's a lot of misinformation on social media. If as doctors, if as people who are working in health sector, if we get to know that, okay, this is the misinformation which is doing round, or this is something which is becoming viral, so as a doctor, as a health practitioners, we can debunk that particular information. So for that, the first and the foremost thing is we need to know what is happening on social media, because nowadays people are interacting more on social media. So if you look at a family of 4 people, you'll see, they're sitting in the same room, but all of them might be having their smartphones, and they are talking to their friends on social media and all. So there's a lot of conversations which are happening on social media that needs to be monitored, which actually gives us a trend, what people are talking about. So how does this help you, and how does this apply to you as a doctor, as a hospital, as an expert, or as a parent? So I was thinking that since it's a International Pediatric Association event, so maybe like there are a lot of parents who might be part of this. I'm not very sure, but yeah, if they are there in this particular group, that's a very good thing. So how does this apply to you? So as a doctor, as I said, that we need to know what people are actually searching. Nowadays doctors may like it or they may not like it, but there are a lot of people, if they face any problem, the first thing which they do is that they go to their smartphones and they try and search about that particular problem. Of course, I've seen a lot of doctors getting irritated by that, but that's the reality. This is what is something which is happening. So they also need to know, what exactly people are searching. Say, for example, when we talk about vaccine hesitancy, now we need to know why people are hesitant. What are the different reasons for this? There could be cultural reasons, there could be medical reasons. So if we know what people are talking about, yes, then we can actually solve that particular problem to a certain extent. So this is applicable for all the age groups. Now, as I said, it's very important. Why it is important right now to listen to what is happening on social media? Because there is a fundamental shift which is happening in the way we are finding information, the way we are making decisions, the way we are engaging with people, and the way we are making ourselves heard. So maybe like 10 years before, if I had to visit a doctor, or like I have to go to a hospital, the one thing which I would do, it was maybe like to interact with my relatives or my friends and ask them who's the best doctor in this particular area, or which hospital should I visit. We are not doing that anymore. The only thing which we are doing is that we are turning towards our smartphone to get answers to all these things. So all of us, we are living in those micro movements, and this is something which we all need to understand what these micro movements are. People who are there in the field of advertising, public relations, media, they have understood these micro movements are very important movements. These are the movements wherein people take decisions related to certain thing. Say, for example, decision related to whether I should go and get myself vaccinated or not. These decisions are taken during these micro movements. So what these micro movements are? These micro movements occur when people reflexively turn to a device, increasingly, of course, their smartphone, to act on a need to learn something, do something, discover something, watch something, or buy something. And they are intent rich movements when decisions are made and preferences are shaped. So these are very, very important movements for everyone, for a doctor, for a hospital, for parents. These are the moments wherein, there's a lot is happening, and everything is happening on smartphones, because people are searching that particular content on their phones or maybe like on their laptops. So Google actually came out with this. There are 4 game-changing movements that really matter. So first one is I want to know movement. So for example, when someone is exploring or researching, but is not necessarily in a purchase mode. So I have a problem, but right now I am not looking at visiting a hospital or a doctor. So what I do is I just pick up the smartphone, and I'll say that, okay, what are the kind of headaches people have when they are having any spinal problem and all. So this is I want to know movements. I want to know about that particular problem. Then the second is I want to go movements, which means when someone is looking for a local business or is considering buying one particular product. So for example, if I have to visit a doctor, so the first thing which I'll do is I'll try and find a doctor or an hospital which is near me. So if that thing is available, definitely like I'll try, or maybe like book an appointment and go to that particular hospital. And then you have I want to do movements when someone wants help completing a task or trying something new. And then I want to buy movements wherein you actually go to a store, you buy something, or you go to a hospital, or you get yourself vaccinated with whatever vaccine is available, whether it's Covaxin, Covishield, Sputnik, or like anything. So that's the decision which you are making, and you're getting the things done. So these are 4 game-changing movements. Now these movements can be applied to any field. I am talking right now about brands. I'm talking about advertising, marketing field. But see, even like army, they also have these movements, and they are leveraging all those movements. Say for example, if we talk about Indian Army, so there are movements like I want to know movements. For example, people who would like to join army. So these are the I want to know movements wherein they are searching about Indian Army. There are movements like I want to do movements, which means like maybe like they want to do a certain training before that, maybe like they want to attend a certain coaching before they appear for their SSB exam. So these are I want to do movements. And then of course like you have I want to prepare movements. So wherein they are searching a lot of content related to how I should prepare to be a part of this very big and very respectable organization. So these are some movements. Now talking about health sector, so we have such movements in health sector also. So the first thing is, where can I get treatment movements? These are the movements wherein people are searching content related to this. So how to win, where can I treat movements? And as I treatment movements, and as I said, that we need to leverage these movements for the doctors, for the hospitals, for all the people who are working in the field of health. They need to know these movements, and they need to leverage these movements, and they need to win these movements. So how can we do that? First, be there for local searches, right? For example, Sputnik vaccine is available in India right now. But how do I know in which hospital it is available? So for the hospitals, it becomes very necessary that they should be available in the local searches, showing up for near me searches. Many a time, we type a search query with the near me, that okay, vaccination center near me. So is your hospital listed there? Or maybe like a dental expert near me. Is your name listed there? If you are listed there, you exist for that local population. And if it is not there, you just don't exist right now, because There are a lot of people who make decision on the basis of what is actually available on their smartphones and all. So it make it easy for people searching mobile to find your office by bidding on location specific keywords. So there is a way of doing it. Right now I will not get into it, but yeah, little bit I'll talk about keywords and all, because that's actually the cornerstone of online searches. Then show up for a variety of terms. It's not that you're just talking about Sputnik vaccine. You have to use different words also. For example, is it available on weekends? So, for example, open weekends, online appointments, comfortable waiting rooms. So this is how people are searching online. So when they're searching with these search queries, we should be there with the answer. If my hospital is there with the answer that yes, I'm available on weekend and we are, treating patients on the weekend, then we exist for our target audience. Otherwise, we do not. Or maybe like they go to some another hospital, or maybe like they'll visit some another doctor. And then showcase the essentials. So each and every person, expert, doctor, or a hospital, they have, their own USP. They have their own expertise. So that is something which we need to tell them that, okay, this is our, expertise. You also need to include, your business hours, your phone number, your street address. This might be a common sense for many of us that, okay, even if it is a website, these are the things usually we have. But let me tell you one thing. There have been researches who have been done with the patients and all, and they said that, oh, we wanted to go, but we couldn't go because we didn't know that, whether that particular hospital was open on weekend or not. So these are the things which we need to have, and this is how we can win. Where can I get treatment movements? Then what all other movements do we have? Who can I trust movements? And this is the most important thing when we talk about hospitals and when we talk about doctors. Every day, being I am part of number of groups, so are like most of you. We keep receiving these queries from a lot of people in the Facebook groups, on WhatsApp, that who is the best doctor in this particular area, right? And which is the best hospital. So who can I trust movements, and how do you win who can I trust movements? First, when you list yourself there, you need to include reviews. People read reviews a lot. It could be positive for you, like if there are positive reviews, but yes, people do leave negative feedback also. Then make a positive first impression. Say, for example, if you have a website, for example, if you have a website on International Pediatric Association, so that's the first impression people are having of this association. So one has to be very careful, when we are designing that particular website. So which means upload clear, high quality photos of your office, write detailed treatment descriptions with benefits clearly communicated, include page with detailed practitioner's bio, qualification. This is exactly people are looking for, right? This is what they are actually searching. So you might say that, okay, we are in the field of health, we are doctors, we are, hospitals, administrator in hospital. So why should we get into this? I received the same response when we conduct the workshops for officials from defense forces. So when we started doing these social media workshops for them, and when we told them that it's very important for you to have online presence, because people don't pick up their phone and call key where the recruitment is happening. It should be available on your website. So initially there were there was this apprehension, but now everybody knows that yes, you have to have your online presence. If you will not tell your story, someone else will tell. So you need to have your narrative. You need to tell people what you actually stand for as a doctor and as a hospital, and make sure the price is right. That's the most important thing. And there's a lot of controversy which keeps going on. So high prices for in health sector and all. Then I'm ready to book movements. So this is the third. So you have done entire research. You are satisfied with the kind of information which you've got on, a one particular website of a hospital, or maybe a web page of a doctor, and then you want to, book that particular, maybe like an appointment. So these are the things which we have to keep in mind. Test your site. for mobile friendliness, because most of the time we are booking from our mobile phones. Maybe like young people, older people, still, they are on their desktop or laptops. But if you talk about the younger generation, and in fact, like I also do most of my booking and purchasing like through mobile. So whether your website is mobile friendly, that is something which we need to know. Then offer convenient conversation starters. You need to have some sort of conversation to engage with your audience on your website. So if someone coming onto your website, there should be some pop-up like, can I help you? Are you looking for an appointment? So like, what kind of doctor are you looking at? So these are the things which should be there. And then the booking process should be as simple as possible, right? We know that everybody needs data, you need to fill up a form, but the people do not have that much of time and patience. You can do it a little later, but the online booking process has to be very, very simple. So this is how you leverage these movements. Now people are also searching when they are curious. For example, this is the graph of COVID-19, what people and how people were searching about COVID-19. And I started from 2019, of course, like it was not there, but you can see the spike here, right? It was like around March 2020. So suddenly, like, people started asking a lot of questions related to COVID-19. How it can be prevented, and we have seen at that point of time that there were a lot of misinformation and disinformation related to that. And in fact, it is not there in this presentation, but I do have a lot of examples, and then of course these examples are available on WHO websites also, the kind of rumors which were spread related to COVID-19. So people are searching. Now what does it mean? When people are searching, we need to be ready with the answers. We need to know that, okay, people have these questions in mind, and we need to, as an expert, I need to have an answer to those questions. This is also, these are the two comparative graph. One is for, of course, like the search query was COVID-19, and the second one is the vaccine, right? And see like how it's spiking. So people are searching about it. They are asking a lot of questions. They also search when they want answers. So you just type COVID, you just type Covaxin, you just type Sputnik, and you'll get to know what people are trying to find out. So if people are trying to find out this information, as a health practitioner, are we providing them this information or not? Right? So this is something which we have to ask ourselves. This is another graph, and I'll show you the tool for this, how you can prepare. Say, for example, one search query, COVID-19. Now, these are the kind of questions which people are asking. So let's have, maybe like an Excel sheet and have all the questions, and then we should be ready, with the answer to each and every question. Or maybe like, for the doctors and those who are working in this field, this also gives you a lot of insight, and you can also write a paper based on the kind of data which is available on social media. So what will this do once you know what people are searching? This will help in understanding the trend, what people are talking about, right? What are they, what are the issues they interacting upon? What is important for them? So it will help us to understand the trend. You'll get to know, like how people are talking about, mental health. So there are a number of tools wherein you can find out like what are the different groups which are available who are talking about mental health, or maybe like adolescent mental health. So it actually gives you a trend. Professional development. As I said before, there is a lot of data, right? You do not have to collect the data, go to the field and collect the data. There is already a lot of data available on social media, and you can write, excellent papers, keeping in view the data which is already available on social media. Third, turning negative situation into positive. When you know that, okay, this is something which is going viral and this is not right, there can be an intervention from an expert side that, okay, we need to debunk this particular sort of misinformation and disinformation. And then, of course, you can find influencers. And this is what, people are doing. You need to have a community who who all are talking about, maybe child health. So you create a community and you need to know what these influencers are talking about. Many a time, because I keep conducting, training programs on fact checking and verification, many times I have seen even the influencers, they spread rumors. So we should be aware of who these influencers are and what kind of information they are actually sharing with their audience. When I'm saying influencers, they are the people who have, a lot of fan following on social media, whether it's Facebook, Twitter, Instagram, or like other, so this I'm leaving for a while. So now you know what people are talking about. You know that, okay, that this is what they're talking about. What next? What do you do with that? So keywords are something which is very, very important for all of us. Say for till now, I was saying that you need to know what people are talking about. I talked about search queries. So whatever they are searching in that search engine is a search query for them. For the people who are maybe like, running a website, say for example, hospital's website, or maybe a doctor who has his or her own blog, for them, they are the keywords. So if someone is typing a search query, right, then, they should get answer to that. For example, today I want to know about, vaccine hesitancy. So what I'll do is I'll just write these two keywords, and then the result will appear on search engine result page. So what do? As a reader, we see first page, second page, at the most third page, and after that we change our search query. So keywords are very, very important. And when people are searching, then your content should appear there. That should be the main objective when we are working on digital platforms. So vaccine hesitancy, as a doctor, if I have written an article on that, my article should come on first page, and I need to work towards that. Or like in a hospital, like if we have actually brought out certain IEC material on that, that should appear on first page. So keywords are very, very important. These are also called search queries. This is how you search, content online. So keywords are ideas and topics that define what your content is about. In terms of SEO is search engine optimization. They are the words and phrases that searchers enter into search engine, also called search query. So for me, it's a search query when I'm typing that, but of course it can be a keyword for the people who are actually creating the content. I know it could be little technical, but these are the normal things which we all need to understand. Because see, there used to be a time when we used to talk about library. Someone has to go to library, and this is how the books are kept in the library. So everybody need to know that. The same applies for the digital platform. And I'll just very quickly get into, because I'll be talking about keywords in detail. But before that, we also need to know how search engine works. Say, for example, if I have to search something, the first thing which I do is I go to Google and I type that search query. But how those search engine works so that we get those results. The first stage is crawling. Google search engines, they have bots. They call it crawlers also. They keep on crawling the web, and they keep on indexing the content. Whatever the new content is being created, that is being indexed. So there is a database that is actually added to the database. And then they give ranking. That's why some articles are there on first page, around 10, and then you have second page, third page, and there are millions of pages, right? So how do they rank? They rank on the basis of the quality of content. They also rank whether that search query is matching your content or not. So which means you need to insert those keywords in your content, when you are creating that particular content. So someone is writing, say, for example, vaccine hesitancy, and if your article has vaccine hesitancy, so it will match, and that particular article will be retrieved, and it will be showcased on the first search engine result page. So that is something which we need to work on. So keywords, as I said, very, very important. You need to know what are the keywords in your area, whatever field you are working in. So you can brainstorm those keywords. You can write obvious keywords. You can look at the competing sites. What keywords are they using? I've written the way it has been done, and I'll be sharing my presentation also. So you can use this, and you can find out, say for example, what Apollo is using, and what maybe like Medanta is using, what Fortis is using, and all of them they are using because they want to appear on the first search engine result page. Then share it with your colleagues. Spelling mistakes are very important, right? When people are searching, there are a lot of people who are making spelling mistakes. So those mistakes, misspelled words are also very important. So for example, if you want to know about vaccine, so you can also type vaccine, because there are a lot of people who are searching vaccine with this particular spelling. Then synonyms, say for example, when I'm talking about digital, you can use new media also. Split and merge words. So if you're using email, then you have to use it, both ways. Hyphenated words, singular, plural. Say for example, how do people search? People always search that best books, right? They don't search for book. So these are the things which we have to keep in mind. And then of course, geo terms, names of the towns. Like say for example, if someone is searching Medanta, Gurgaon also, these are the geo-targeted terms, and of course your company names. Planning keyword strategies. This is, I'm talking about your website, your blog, your digital presence. So where to use keywords? In the URL, right? So for example, that uniform resource locator, the URL of that particular page, there you should have keyword, which means what people are searching. Then it becomes relevant for the search engine, and it will be there on the first search engine result page. Title tag. So title of your page, there you should use those keywords. Vaccine hesitancy should come in the title. Description tag. So when you're writing articles, there is a possibility everywhere that you give description of that particular page, right? So when you those who have worked would know it, but if you have not worked, not an issue at all. You just have to tell the person who is working for you that, see, you need to know the keywords and you need to insert keywords at these places. All tags, which means we use a lot of images. Now search engine, they do not read images, they just read text. So when the images are being uploaded, with each and every image, there should be a caption. And in the caption, you can use those keywords. Then, of course, geo-targeting. Long tail keywords are people, they do use, words, but they also use, long, words. Where can I get Covaxin, or where can I get Covishield? Is Sputnik available in Delhi? So these are the long tail keywords. So we have to use that also if we are searching content. So the best thing is, when we are searching content, online search, we need to use smart keywords. Search is only as good as your keywords. So if you are searching online, you have to use keywords very strategically. Say for example, oh, I'm extremely sorry I saved this, but it didn't work. For example, COVID-19, right? So coronavirus, then you have misspelling also, COVID-19, flu, Moderna, Pfizer. So these are the keywords which are being used for COVID-19. And we need to master Boolean queries. These are all search operators. It's not difficult. It looks difficult in the first instance, but if you start using it, it becomes very easy for you to search content online, whether you want to see what people are talking about, or if you are maybe like surfing internet to find out documents related to the kind of research which you are actually doing. So these are certain search operators, like and this is the main part of the presentation. So this is something which you should keep in mind. For example, when we are searching in Google search engine, use operators like and. So when you are saying vaccine and injury, it actually limits your results. So what is happening in this case is that you're getting those results wherein vaccine and injury, both these keywords are used together, right? So you'll get those results. So this is limiting your results. So you're only talking about vaccine and injury, and this is coming. Second is when you use or. For example, Covaxin or Covishield. This expands your result. So you're getting all the results wherein either Covaxin is used or Covishield is used. So if you want to limit, if you want to be very specific that no, I'm only talking about vaccine and injury, then you use and if you want to expand it and you want to have an article where Covaxin is also used or Covishield is also used, then in that case you used or. Then minus not excludes from the result. Say for example, you are doing research and you want to find out that which one is popular and what people are talking about, Covaxin or Covishield, but you do not want Sputnik now. So what you do is you write vaccine because this is something which you want, but you minus Sputnik from there. So from the result, Sputnik will be excluded and you'll get result for other vaccines. Parenthesis, it lets you combine and or searches, and you can do a lot with this. Say for example, if you want to talk about a vaccine and injury, right? So you can say Moderna or Pfizer or Covaxin or Covishield, anything, whatever it is, and then you write and then injury or harm. So you're using parentheses, but you're also using or and operators in this case. For example, this one. You are doing a research wherein you are trying to find out, what people are actually talking about vaccines and injuries, right? Or like the harmful effects. That's the research which you are doing as a doctor or in hospital. So what do you do? First, you type vaccine or vaccinate or Moderna or Pfizer or AstraZeneca, all the vaccines, and then the words which are related to harm. And then you club it together using parentheses. In this case, what will happen, you'll get a lot of results wherein the vaccines, it could be any vaccine, and the harmful effects, and it could be any harmful effects like brain barrier, autism, side effect, everything will come in that, the result on search engine result page. Consider misspellings also. This is what I said earlier also. There are a lot of people who search content with misspelled words. So that becomes very important when we are searching content online. So do that. So here, I have actually given example of some of the spelling mistakes. So these are the basic Boolean queries which each one of us should master. It's not that right now you're doing the workshop on social media monitoring, and this is something which is very exclusive to social media. No. If you sit in front of your laptop, if you're doing your research, then these are the things which you should have expertise in. This is like one of the skill which is expected in today's age, digital age. So always put and or in capital letters. That is something which you have to keep in mind. Use or to expand your results or and to limit your results. Use quotation marks to search for a phrase. Say for example, vaccine hesitancy. I just want to have this particular phrase, put it in the quotation mark and search that. Use me, my, and I to find eyewitness experiences. Say for example, when the vaccination process started, there were a lot of people who were telling about their own experiences. So if you really want to have those eyewitness experiences, then use me, my, I to find out those eyewitness experiences. Group similar keywords in parentheses the way we had discussed, and of course, like you need to check the work also. These are some more examples of operators. I just have a look at the time. Anyways, these are more operators. Say for related. Now related colon, you'll find sites related to this particular domain. link.youtube.com, which means this will find results that link to that page. Site, you want to know like whether this word is used in this type of site. Say for example, here it is written .gov.uk. I can say .gov.in, and I want to see where all vaccine term is being used in all the Indian government websites. So I can use this. In text, find results showing up on web page in many areas such as title, page, URL. So if you write in text colon immigration, so it will give you all the all the results wherein this particular word was used, whether it was text, whether it was headline. Then of course, important one, in title. So you want to search for the articles wherein the title was in the title, that particular keyword was used, so which is very important when you are doing research. And then of course site, for example, you want to find out what WHO has written about vaccine hesitancy in their site. So you just write site column WHO, right? And then you can search for that particular thing. So these are number of operators. I'll be sharing this particular slide with you. You just have to see how it actually works. Now coming on to Facebook pages, there are number of Facebook pages. There are number of public groups. Say for example, you want to find out mental health and children. Now this is an important issue for all of you, right? You are working in this particular field. So what you have to do is you have to write site facebook.com/pages mental health and children, right? And it will give you all the public groups which are there on mental health and children, right? And then maybe you can be there in that particular group and you can try and find out what sort of conversation is happening in that particular group. Similarly, this. So you want to know about what are the different groups available on adolescent health. Here what I've done is I've written quotations, so exactly that specific word I would like to find out, and you will get a lot of Facebook pages wherein this particular term is used, and the pages with this particular title. So this is how you actually find out content or search content on social media. Now, these are certain tricks which you can use, right, when you are searching content online. Now, there are certain tools also. For example, you have CrowdTangle, you have Who Posted What, Facebook Graph Searcher, Graph Tips. They all give you a lot of information related to what's happening on Facebook. Right? For example, I just want to search on mental health. And the moment I type mental health, it will give me all the results of mental health, what people are talking about in different groups, in different pages. So all those results will be there on the dashboard. Then you have Spoonbill, you have Tweet Beaver, you have Follow Me. TweetDeck is another very important tool which can be used for Twitter monitoring, right? You just have to write the search query and it will give you all the details. Google Trend is another one. If you want to know what people are searching at one particular time, or you can customize that range also. You want to know that, okay, say for example, you conduct an event, a seminar, and you want to know that during that period, how many people searched for this particular search query. So you can find that particular information. Answer the Public, I actually showed you an example of this in one of my slides earlier. So this is all from my side. Now I just need to know how much time do I have, because if you allow quickly, I'll take you through all these tools because all the tabs are open. So I just want to show you how actually these tools look like. For example, this is CrowdTangle, right? And these are all free tools which are available. For example, if I say I just want to know about mental health, right? So I'll type mental health and it will give me all the results. These are the interactions which are happening, right? And these are the different posts. And then of course, these are the filters. So for example, I just want from the verified status, I can do that. Page category, I can do that. Post type means do you want to see the text post, or you just want to see images or videos? So these are the different filters. So it will give you all the information what people are talking about mental health. This is another tool which is Who Posted What. And this also you have, you just have to write keywords, specific month. You can customize that range also. You can talk about location, that what people are talking about Sputnik in India. So you just write, Sputnik, you write the location, and then you can search for this. This is another tool which is important tool. especially like used for fact checking and verification. There are a lot of people who keep changing their tweets, who keep changing their bio and all. So this actually gives you the whole idea, you know, who has changed their name, bio, website, location. So this is an interesting tool. This is like, as I told you, Google Trends. So you just have to search for that particular term, and then of course you can search in any of the country, right? So what people are searching, for example, right now, I say Sputnik, right? And this is the this is what suddenly, like, people, we know that, you know, that it has, you know, started in India, and people are searching about it. And it also tells you about the sub regions, different states. It also tells you the related topics, so it gives you a lot of information, and you can compare it with other search query. So this is about, this is Tweetweaver. This also gives you a lot of information related to Twitter, right? So for example, you know, you want to download users timeline, so you convert ID number to name. So there are a lot of features in this. You need to explore this, but whenever you have time, these are easy tools. They are not at all difficult tools. It's just that you need to spend some time. This is TweetDeck, right? Say for example, I typed these search queries, these hashtags. I typed this one, hashtag IPA World Organization, and now, like, we can see, you know, all these things are coming. You know what is happening on Twitter right now. So this is how you can search on Twitter what exactly people are talking about related to this search query, and you can keep on adding column, you know, whatever you want. So you can add another column. You can add user also, what a one particular user. You can add followers, what your followers are talking about. So these are the different columns that can be added here. So I think, okay, this is the, okay, this is one very interesting website, a resource for all the researchers. Say for example, you want to know, this is Wayback Machine. So you just have to type Wayback Machine and you reach here. You just have to type the URL of that particular website. So this is WHO website. Now these are all archived pages. Now you want to compare, say for you are doing a research and you want to compare that now WHO is talking about COVID-19 a lot, and this is how their website looks like, and these are the number of articles they have written on this particular issue. But you would like to compare it with maybe like some epidemic which happened earlier, right? So what you have to do is you just have to click on that specific date or period, and then you click on one particular date. You will reach to the website. You'll see the website that it looked like on that particular date, right? It's not just the articles, population of article, how WHO website looked like on that particular day. So you'll get the design, everything will be like that. So it's a interesting resource for the researchers. So this also I would like you people to explore. It gives you a lot of data. Say for example, backwards you want to know how different pandemic, epidemic were covered and what kind of articles were written. Right now I've taken WHO. You can take any media house, how New York Times has covered or how Washington Post had covered. And then this is the last tool which I wanted to show, and we've already seen, say for example, this is called Answer the Public. This also tells you what people are searching. So I'll just again type Sputnik, and then I'll search, right? And of course, right now UK is written, so it will give me data from there. But so it will give me the complete visualization of what people are searching about Sputnik, right? So these are the questions which researchers, medical practitioners should know, because people are asking these questions and they should have answer to it. And if not answer, then of course this is a good insight for conducting research. So I think that's all from my side, and I've taken more time, but there are certain things which actually I wanted to show you because I felt that there should be some takeaway from the workshop, right? So now I think we can take questions. Manisha, that's all from my side.
Thank you, Lucy. It was so interesting and informative. And I know that it was just a tip of the iceberg, because we can spend hours, I know that there is so much more that you offer. And I mean, we have so many questions, and I'm sorry that we don't have that much time, but we'll take at least a few questions, that you already. Okay, like, are there any suggested sites to look for keywords?
You're not audible. I mean, I can't.
Can't hear me?
Can you type it in the chat box, Manisha? Which question are you taking? Because I can't hear you properly. Okay, so are there any suggested sites for keywords? Yes. So, for example, you want to find out find out keywords related to your area. Whatever you are working in. So there is a site which is called Keyword Planner. This is like Google AdWords feature. Earlier it was a separate platform, but Keyword Planner is one site which can give you a lot of keywords if you are actually working in this particular area. For example, you just have to write COVID-19 and it will give you a list of keywords which are related keywords and which people might be using to search content related to that. So that is called Keyword Planner, and this is actually part of Google AdWords, right? Basically used by marketing people, but yeah, a lot of other people can also use it. That feature is freely available in this. Okay, so are there any suggested site for keywords? I said, why Sputnik vaccine is still not approved by WHO? Extremely sorry, I don't have answer to this. So my domain is social media monitoring. So this is something which you have to discuss it amongst yourself to get an answer to this. So is WhatsApp okay? I'll take this question. Just a moment. Is WhatsApp considered a social media platform, and can it be searched for information? See, WhatsApp, yes, it's a social media platform. The moment you create groups, right? So, for example, we do have a lot of groups, and many a times, when we create a group and when we share the link of that maybe like on any other social media and ask people to join that group, then it becomes a public group. So this is a social media platform, but the problem with this is that we all know that this is a closed space, and definitely, like, of course you have to be a part of that particular group to find out what is happening in that group. So it's end-to-end encrypted, so we cannot do that. There are a lot of issues. Say for example, for Facebook groups, Facebook pages, you can do it easily. For websites, you can do it easily, but these are the closed spaces where the challenge is there. But yeah, it can be considered as a social media platform, and it can be searched for the information if it is a public group. So do you need subscription for the use of search tools like CrowdTangle? CrowdTangle, of course, it's a paid this thing, but they have made this available for the researchers, academicians. So you just have to write to them, and they'll be willing to share the details with you, and you will get the subscription of that. I have it, and in fact, like they have good community of researchers who are conducting research using CrowdTangle. So please do write to them. Go to CrowdTangle, please write to them and request them that it should be given to you so that you can use that data in your research. Okay, so
Can you hear me now? Can you hear me now? You can't?
yes.
here is another question that was asked a little while back, and it says that all search engines do commercial information marketing. So while searching, how do we know that the information popping up is not motivated to impact stories, articles, etc. by journalists?
Okay, so I'll just tell you one thing. Say, whatever you see on Google, right? There are two types of results which we get. One is organic, and the other one is inorganic. When you type any search query, you'll see there are a lot of advertisements there. With that, ad is written, so you know these are the ads, and someone has paid for that, right? Then you have a lot of articles which come, and that comes as an organic result. But when I'm saying organic result, there is a challenge. Say for example, there are certain companies who have done a lot of good search engine optimization, and that's why their page is ranked on the first search engine result page. So definitely that angle is there. And it if an article is appearing on the first page, second page, third page, doesn't mean that that those are the best articles. It's just that someone has actually worked on that to make it appear on the first search engine result page. And it is not necessary that the article which is appearing on the 50th page or 100th page is not a good article. It can be a very good article, but maybe like the people have not worked on search engine optimization or keywords on that particular article. So that is the problem that is there. But that's the only way we have to search content on the internet. So the idea is that even the good people, researchers, they should be aware tricks of search engine optimization, so that their content should also appear on maybe like first, second, third pages. Yeah.
In one last question now, because we are already running a bit late. And several people have asked this, that how do we confirm whether the news, photo, video being circulated in social media is authentic or not, and from which site?
I didn't get. How do we?
How do we confirm whether the news or photo or video being circulated in social media is authentic?
Okay, yeah. So this is it's a very good question. In fact, we can have one more presentation on this, which means when you see, a photograph or a video going viral on social media platform, there are ways of, fact checking that content. For example, you receive an image and you say that, okay, this is an image of XYZ went for vaccination, and he faced this particular problem, and this image is viral. So how do you fact check that? Now image can be fact checked by reverse image search. There are a number of tools for that. There is reverse image search, there is TinEye, there is RevEye. So these are the tools for fact checking images. If you see a video, there are a lot of tools for video fact checking, like you have in video, right? You have watch frame by frame. You have there is Amnesty International tool also. So which is YouTube Finder. So these are the tools which are available to fact check the content. But the most important thing, and I think Manisha would agree to it, when we receive any content and when we see anything on social media, we need to ask questions, right? One, who created this particular message, right? Why is it viral? Is it like insightful? What kind of language is used? And then you need to answer to those particular questions, and then you have to make your own decision, whether it's right or wrong. Or maybe what you can do is you can use all these tools. If you cannot use these tools, I will suggest all of you to go to this website, which is IFCN, which is International Fact Checking Network. So IFCN, with Google, they started a bot. That's a WhatsApp number. It will be there on their website. You just send a message, hi, and then it will also tell you like what are the fact check story near you, like your location. And if in case you want to send a story for fact checking, you can send it to them. They'll do it for you, right? So that's one thing. Then Google also had started, even at the time of the pandemic, which is called Google Fact Check Explorer. You just type it, Fact Check Explorer, and there also you can type that search query related to that particular content. And if it is not authentic, some third-party fact-checking organization might have already fact-checked that, and you'll get that particular information. So there are a number of things which you can do. In fact, like we do conduct a very long workshop on fact checking and verification, and that's also very interesting. And so, I mean, I'm always open to that also.
Thank you so much.
Okay.
And I know there are several more questions and you have much more to say, but I think we are already past 20 minutes and our announced time. So we will
Yeah.
stop here. I would like to tell all the participants that we will be sharing all the questions and their answers along with, the recording with all the participants. So there are questions like whether you would be sharing the presentation with the participants.
And also on my Twitter, I have a pinned tweet wherein I have discussed about 100 digital tools, so which are there. And if you want to access them, they are available there, and I keep adding to that. So that's my Twitter handle. So you can search there also. So thank you so much. I can see a lot of questions. I want to take each one of this, but I'm so sorry because I feel that there are many who will be waiting for their dinner also.
A big thank you, Vipati, and we hope that we'll have many more sessions with you because participants are interested in many other dimensions. So I would now like to invite Professor Aman Pulungan for his closing remarks. To introduce Professor Pulungan is not very easy, because when I read his introduction, you'll know how many organizations he's associated with. So he is a professor of pediatrics, executive director of the International Pediatric Association, the president of Indonesian Pediatric Society, president of the Asia Pacific Pediatric Association, a senior consultant in pediatric endocrinology, Faculty of Medicine, University of Indonesia. He is also on the Committee for Medical Specialist Deployment, Ministry of Health of Republic of Indonesia, NCD, Child Governing Council, and past president of the Asia Pacific Pediatric Endocrine Society. For the past 20 years, Professor Aman has been involved in many programs for diabetes in Indonesia, another very important health area, and even in the region, among others. As a project leader for the World Diabetes Foundation Type 1 GM in Indonesia, and as a member of the advisory board of the Physician International Society for Pediatric and Adolescent Diabetes. Thank you for being here, Professor Aman, and I invite you to give your closing remarks now.
Okay, thank you very much, Professor Manisa. Good evening and good afternoon, probably in some part of the world. Yeah, it's a great honor for me actually to join this workshop. Yeah, I think it's I was enjoying also the presentation of Professor Yadav. It's something that new that everybody should know right now. Actually, I am a really conservative person before because I'm a pediatric endocrinology. I'm a researcher, but right now, managing International Pediatric Association is something really different, especially during this pandemic. So we have to screen which one is really hoax one or it's a really true one with the based on the scientific evidence. Because right now we have to learn, we have to screen the anti-vaccine. They're still using social media. Also, the group right now who they think that the pandemic they don't believe the pandemic, or they think that the pandemic is the conspiracy. This is also the problem. So as the organization like International Pediatric Association, we have to lead all the pediatricians all over the world. Yeah, and I think more than 150 countries join in our society. I think this project, IPA Vaccine Trust Project, we have to support it. And this workshop tonight, I think this is something that, you know, we have to share in all of our members, I think. So thank you very much also, Dr. Jacob John and Professor Manisa, and of course, Professor Yadav. And if you don't mind, Professor Yadav, I think we will share your presentation to all of our members, I think. And I hope we can have this session again. Probably this is only part 1, I think, at the beginning. I think we need to go to the outside for part 2 of this, your presentation. Yeah, I was really enjoying your presentation. I think this is something new to us. Yeah. Yes, right now also I have Twitter, I have Instagram, I have Facebook, I have LinkedIn. We have to do it at the same time all together. And of course, thank you very much for the all participants who already joined this, and also Dr. Tecker as the project leader of the IPA Vaccine Trust Project. Thank you again, yeah, Professor Salat, Professor Yadav, Dr. John, and everybody who are joining for this workshop tonight. Yeah, I would like to close this meeting formally. Thank you again.
Thank you. Thank you.
This
Should we leave? Okay. Thank you. Good night, everybody.
fun. Thank you. Have a nice day and good night
Okay.
wherever you are.
Thank you all.
Good night.